arduous fight in the past 40 days. The situation in Beijing has shown a stable momentum in containing COVID-19 outbreak. And we has also enlarged our achievement in fighting COVID-19 in Beijing. And we also have seen the good momentum for getting better. And of course, this is not the time for us to celebrate. We should always keep the level-headed and keep high alert to the critical situation in Beijing. And this is the time that we should tighten up our measures in containing the virus and always stay in the wartime, which means that we should not slacken off our efforts in containing the COVID-19, and we should also further consolidate the responsibilities of 4 involved parties and always find out the loophole and improve all the weak links in order to cut off the transmission of the virus and also contain the further spreading of the virus. And for the public areas, they should do a good job in cleaning and also to conduct the regular ventilation, as well as the disinfectant efforts should be done in the Municipality wholesale market. And the special focus should also go to the areas such as the restaurants and also the public gathering venues. And we should also conduct a work on preventing the cross-infections. So we should actually know exactly the role and responsibility everyone should take on regarding the 4-party responsibilities. And we would like to call on the residents in Beijing to abide by the rules and regulations, especially wearing masks, conducting the ventilation, no parties, no public gatherings, no mass gatherings. And also, if you show any symptoms, please pay a visit to the hospital or fever clinics. And people, if you stay at home for quarantine, please follow the rules and do not go out. Especially do no mass production, and also provide the report of your temperature daily. And if you exhibit any symptoms, please pay the visit to the hospitals and also do regular environmental disinfectants. We should make the all-out efforts and united as one. We believe we will very soon to achieve the V-Day in fighting COVID-19. And today we have invited people from the Beijing CDC, Peking University, and the Peking University of International Hospital, as well as the Forest Engineering 18th Bureau Group of CRRC to attend our press conference to give you the more detailed information. Please allow me to introduce our special guests with us today. They are Deputy Director of Beijing CDC, Madam Pang Xinhuo, Dean of and the President of Peking University International Hospital, Mr. Chen Zhongqiang, Vice Dean of School of Medical Humanities of Peking University, Wang Yue, and Mr. Gao Chungen, Party Secretary of the China Railway 18th Bureau Group Force Engineering Co. Limited. Now I give the floor to Madam Pang Xinhuo for the updated information regarding the newly confirmed cases as well as the result of epidemiological results, and also to give us the ideas regarding the disinfection work in the washrooms. Friends from the media, now I'd like to give you more information regarding the newly confirmed cases yesterday. From 0 to 24 o'clock, the newly confirmed COVID-19 cases was 1. Now I would like to give you the elaborated information. The 44-year-old man living in Fengtai, Lugouqiao Street, working for a trading hall of a Municipality wholesale market. On 15th of June, he was transported by chartered car to the centralized quarantine area for medical observation. On 27th, he received a PCR. On 28th, showed a positive result for the virus. On 29th of June, transported to Feng Tai, a TCM, a Western Medicine Hospital, and showed the inflammation in both lungs, and confirmed cases on 1st of June with the normal symptoms. Right now, we have shown the better results regarding containing COVID-19, but still we have the risks of contracting COVID-19. So we call on everyone to keep high alert to the COVID-19 and keep your self-hygiene and do not conduct the public gathering. And also for the public areas, please wear masks and keep social distancing. If you show any symptoms, please protect yourself and pay a visit to the hospitals. Do not conduct a public gathering with the symptom exhibited. If you quarantine at home, we discharge you going out, especially conducting the public gathering that cross compound, cross families. If you have any symptoms, please pay the visit to the nearby fever clinics. And regarding the medical institutions, if you receive the patients with symptoms showed, please make the report to CDC and also transport the patients to the designated hospital. And for the related parties, please implement your responsibilities in order to cut off the transmission of the virus. This is the confirmed cases yesterday, and also would like to give everyone the guideline of cleaning washroom. So the washroom actually is dedicated places for people so we need to pay special attention to the environmental hygiene. So first, we need to conduct a good ventilation. So for the washroom at home, please conduct twice ventilation per day for 30 minutes. For each time. And if there is no window, and please install fan inside the washroom and also conduct regular ventilation. For public toilet, you should always keep ventilation. And regarding the garbage in the washroom, you need to clean them on a regular basis and in a frequent manner. And there is no water on the floor. And third, regarding hand hygiene, for the public toilets, you need to have the soap or the liquid sanitizer, and the people working for the toilets, they need to clean their hands by using the chloroquine contained soap, and also use the running water to clean the hands. And for cleaning the floor, you also can use the chloroquine contained the liquid, and also need to clean the floor at least 30 minutes. And regarding the objects inside the toilets, especially the frequently touched places like the doorknobs, you can use the as well as the chloroquine contained the disinfectant, and also the 75% alcohol to clean them. And 6, regarding the mop, I need to have the designated mop for the each specific areas. And also please use the chloroquine contained disinfectant to clean the mops, and that should be inside that disinfection for 30 minutes, and then you need to clean with the running water and dry them completely. Regarding the discontained objects. And please also use the chloroquine contained, the chloroquine. And also for the doors, the walls, we also suggest you to use the chloroquine contained disinfectant to clean or spray the disinfectant. Clean them for 30 minutes and also use the clean water to do a full round cleaning. And for the places you found the contaminated objects, first you need to clean them out and also use the chloroquine contained disinfectant to clean the area for 30 minutes and then use the clean water to do the final cleaning. So for the public toilets, based on all these practice, you also need to, based on your actual situation, to increase the frequency of cleaning. And you also need to pay attention that for the disinfectant is a chemical, and please protect yourself from toxin, and you need to wear the working clothes as well as wearing the gloves, masks, as well as the protective glasses. And also for the disinfectant, it also have that across its vicinity. Please clean the hands by using the clean water, and also please follow the guidelines regarding how to use them and how long you need to keep the disinfectants. And for that disinfectant should be used within the effective dates. Thank you, Madame Pang Xinhuo, for the updated information. And now I would like to give the floor to President Chen Zhongqiang of Peking University International Hospital regarding the normal order restored in the hospital. Friends from the media, on June 17th, a nurse working for the emergency department of the Peking University International Hospital was found as confirmed cases. And we also brought her to the centralized quarantine area, and then it's developed to the confirmed cases of COVID-19. The hospital, as well as the localities and the Peking Epidemic Prevention and Control team, paid special attention to the confirmed case, and we has also locked down the hospital and established a working group. We have done the following. First, we have conducted the epidemiological investigation. Based on our investigation, so with the focus on the confirmed patients as well as close contacts, we have bring all the close contact personnel to the quarantine areas, and we have also worked with the epidemiological experts to pay a visit to the hospital and also conduct a on-site guideline regarding 25 items. Third, we have also conducted disinfectant. So in different areas in the hospital, we have different levels of disinfectants. Make sure that we conduct a strict cleaning work, and we also have taken samples of the environment. Make sure that all the environmental index meet the target. Fourth, for the people involved, they also quarantined in the centralized area or staying at home, and we have also dispatched 21 nurses to give us the further support. Fifth, we also pay attention to the safety of treatment for the 625 patients in hospital. They received a normal treatment. And we also transferred the laying women to other hospitals. And we also have the lockdown, the treatment for the people hospitalized, as well as especially the patients in the emergency departments. Make sure the quality treatment given to the patient. 6, we also have the transport station for objects. For more than 2,600 people locked down in the hospitals, we also have a special team to make all these logistic works. 7th, we also have given the psychological counseling by giving the support to the people needed. The people hospitalized showed some anxieties. We also give them further support. The localities as well as people from the essential group paid twice visit to the Peking University International Hospital with the support of the all parties. During the lockdown time period, we have seen a well-orderly treatment and also contained the virus. So far, we have finished all the cleaning work inside the hospital and all hit the target. For the medical staffs, the patients as well as their family members all showed negative results for the virus. For the close contacts and the related personnel showed no symptoms with the negative result of their PCR. Regarding the 6th edition of Epidemic Prevention and Control released by National Health Commission, yesterday our work has passed the evaluation of Peking Epidemic Prevention Control Group. So starting from yesterday, we unlocked management of Peking University International Hospital, and we will continue to implement the practice of epidemic prevention and control, and we will restore the normal order step by step. So we will continue to implement and improve our system by giving the training to our staffs regarding the nosocomial infectious disease. And second, we will also have the pre-triage service. So for the people involved in this regard, they will also report their body temperature daily. And third, after the unlockdown, for the hospitalized patients, they will receive a normal treatment, and we will also bring back the outpatient service step by step. Since the outbreak, we received a great support from the society. I would like to take this opportunity to appreciate all your support. We will do everything we can to create a safe places to provide service to the people. Thank you. Thank you, Mr. Chen Zhongqiang. Now I give the floor to Mr. Gao Chungen from CRCC regarding the safety in construction site. Friend from the media, good afternoon. We had one case, confirmed cases of COVID-19 reported in one of our construction sites. According to the requirement of Mahut and the CDC, we would like to report you the detailed information. First, we stopped the construction, and also no one allowed to enter into the construction site. Based on the local CDC, for the 95 close contacts were all transferred to the nearby hotel for quarantine. It's 1 person per room. For the people involved in this project, all received a PCR. And we also cooperate with the localities for the epidemiological investigation. The 6 close contacts of the confirmed cases right now is quarantined at the Daxing CDC. And we also conduct our work regarding the disinfectants of the whole environment, especially the dormitories, and we also conduct frequent cleaning for the whole environment. This also gives us a deep understanding that we still have a loophole in the safety construction environment. Therefore, we will improve our practice to make sure that the epidemic prevention and control measures are taken in the construction sites. Thank you. Thank you, Mr. Gao Chenggen. Now give the floor to the friends from the media for Q&A. Please identify your media affiliation before asking questions. Thank you. My question goes to Mr. Wang. So, regarding the legitimate rights and interests, what kind of measures that should be practiced by the personnel? Friends from the media, good afternoon. We have contained the spread of the cluster infection triggered by Xinfadi wholesale market in a very short time. We should give the credit to the strictly implementation of 4-party responsibilities. The notice released by the government emphasized the 4-party responsibilities, and the individual responsibility actually is the top priority among the 4 parties, which also will lead to the success of containing the COVID-19. We can tell that based on the requirement of the NPC, the Peking government, and the local government, everyone actually abide by the rules and regulations. And of course, we have some individual cases that the people not practice the legitimate rights and interests and also the responsibilities. For instance, that the people in the public area do not wear masks, and also people quarantine. In the quarantine period, they still conduct outing and eating with the friends. And also people exhibited symptoms such as fever or coughing, but they failed to report all these symptoms to the localities or CDCs. All these illegal practice might trigger a severe results. This will cause the legal results. So first, regarding the losses of assets, that they need to pay the responsibilities. If the individual not follow the guideline or notice made by the government in the specific time period, then they will receive 5 to 10 days of retain or the penalties, or that may also be a criminal offense. So that is also related to the law of the infectious disease of PRC. And we also talk about the making up or fabricating and spreading the rumors. So according to the punishment in respect to the management of law and order, that the people that are fabricating or spreading rumors, they may receive 5 to 10 days of retaining, and they also may pay their criminal responsibility. Of course, not everyone understands each and every clause of the law, but that could not be the excuse of running away of the responsibilities. So I would like to call on everyone to follow the requirements of the NPC and also the Peking and local governments. If everyone behave themselves, we will for sure win the battle against COVID-19. Thank you. That's the end of Q&A session. The press conference organized by the Information Office of Beijing municipalities and is available on different social media platforms, and you always can stay tuned with CCTV and new media for the updated information regarding the epidemic prevention and control measures and the updated information in Beijing. And it's also available in the different TV channels, and you always can check the latest information. And CCTV and new media will also bring you the live streaming of the press conference each day. Thank you all the speakers, and thank you friends from the media. Thank you everyone. That's the end of the presser. Thank you.